let's cover the major neurotransmitters that you need to know for board certification. Acetylcholine is created in the pontomesencephalon, which is the part of the brain stem where the pons and midbrain connect. And it projects into the thalamus, where it is important for attention, memory, and regulation of thalamic input. Acetylcholine is also created in the basal forebrain, which is the ventromedial frontal lobe, anterior to or toward the front of the caudate and the putamen. And it projects into the hippocampus. It also has other widespread cortical connections. It's important for attention, learning, and memory. Norepinephrine is created in the locus ceruleus, where it is important to attention shifting and arousal, and in the lateral tegmental area, LTA, where it is important for mood and the sleep-wake cycle. Serotonin is created in the rostral raphe, meaning the raphe toward the front, and projects into the forebrain, meaning the thalamus, basal ganglia, and cortex, where it is important for mood and arousal. It is also created in the dorsal raphe, meaning the raphe toward the back, and projects into the cerebellum, medulla, and spinal cord, where it is important for pain, respiration, temperature, and motor control. Dopamine has several functions depending on its origins and projections. When dopamine originates in the mesocortical pathway, or VTA, and projects to the cortical frontal lobe, it is important for executive function, working memory, top-down attention, which is attention that requires volitional control in the face of conflicting demands, and motor initiation. Dysfunction in this mesocortical system produces some of the negative symptoms of schizophrenia, and it can also produce dysexecutive syndromes and bradykinesia. For the mesolimbic pathway, when it again initiates in the ventral tegmental area and projects into the medial temporal lobe, amygdala, nucleus accumbens, and cingulate gyrus, it is important for memory and reward systems. Remember, if you watched my other video about the 4 lobes, that the ventromedial part of the frontal lobe is important for reward. This pathway is involved in addictive behavior. When dopamine originates in the nigrostriatal pathway, or the substantia nigra, and projects into the striatum, aka the caudate and putamen, it's important for motor regulation and thalamic gating. This mesostriatal pathway, or nigrostriatal pathway, is involved in Parkinson's disease, and it can produce both motor and non-motor symptoms. When dopamine is created in the tubero-infundibular pathway, which is the arcuate fasciculus to the tuberal region of the hypothalamus, and projects into the pituitary gland, it is important for lactation, menstruation, and sexual behavior. GABA and glutamate are basically all over the place with widespread cortical connections. GABA is important for inhibition, and glutamate is important for excitatory functions. Okay, let's recap where these babies were born. Acetylcholine originates in the basal forebrain and the brainstem, near where the pons and midbrain connect. Norepinephrine is born in the locus ceruleus and the lateral tegmental area, or LTA. Serotonin is made in the raphe. Dopamine is made in the mesostriatal, mesolimbic, mesocortical, and tubero-infundibular pathways. GABA and glutamate are basically made all over the place. Now let's recap what they do. Acetylcholine is important for attention, learning, memory, and regulation of thalamic output. That's why we give acetylcholinesterase inhibitors to patients with dementia. Norepinephrine is important for attention shifting and arousal. That's why we use drugs like Wellbutrin for attention problems, but also norepinephrine is important for mood. That's why Wellbutrin is helpful for that too. Plus we have other mood drugs like Effexor that work on norepinephrine. And norepinephrine is also important for the sleep-wake cycle. Serotonin is important for mood. That's why we have SSRIs. arousal, pain, respiration, temperature, and motor control. Drugs affecting serotonin are often prescribed for depression, generalized anxiety, and social phobia. Dopamine is important for motor regulation and thalamic gating, memory and reward systems, executive function, and motor initiation, and lactation, menstruation, and sexual behavior. And GABA is inhibitory and glutamate is excitatory.